Hello and welcome to another episode of Community Pulse, a CAN TV program featuring local leaders and organizations focused on improving the health and well-being of the city of Chicago. Community Pulse is presented in partnership with Foxglove Alliance, a public healthcare coalition supported by the Hectone Institute of Medicine in partnership with the Healthcare Council of Chicago, HC3, which is managed by Third Horizon Strategies and Hectone's Nurses in the Humanities. My name is Meghan Phillipp, and I serve as the Executive Director of HC3, the Healthcare Council of Chicago. Today, I am so pleased to have two very inspiring women in the studio with me, Crystal Trinidad and Daphne Bobo, co-founders of Honeysuckle Home. Welcome, ladies.
Thank you.
This interview and us meeting in person is a long time coming. We realize we've known each other for 2 years and have only been virtual, so we're very excited to share their story with you all today. So let's get started. Let's talk about both of you. And both of you are nurses, and I would love for you to share with our audience today how you got into healthcare and what inspired you to become nurses, and we can then talk about how your nursing careers are now morphing into entrepreneurs as nonprofit leaders.
Awesome.
Well, I've been in healthcare all my life. I think I've always wanted to be a nurse, maybe a doctor, but I think I fell into nursing, wanted to be more at the bedside. And then went into nursing school, been a nurse 15 plus years now, and fell into pediatrics and have not looked back. I've done home health, I've done schooling, I've entered the realm of helping youth in care, and that's where me and Crystal met, and we've been pushing through for the last 3 years, working and getting Honeysuckle established to help more youth in care across Illinois.
That's awesome. How about you, Crystal?
One of the things that always makes me laugh about me and Daphne is our stories are always so similar. So I have been a nurse for about 7, 8-ish years. I've done everything like bedside, worked in the hospital, worked in doctor's offices, worked in schools too, but my heart always pulls me back into pediatrics. And as Daphne mentioned, where we met was working with other youth in care who had medical conditions. And when I fell into that role, one, I just loved Daphne's leadership style. We meshed really well together. And we just saw different gaps in care and were able to complement each other's strengths. And here we are.
That's amazing. So, as I said, we have known each other a couple of years, but you have been thinking and working on this project called Honeysuckle Home for a little over 3 years now, correct? And are about to open their very first brick and mortar location to start serving patients and children. So what led, you already alluded to the partnership that you already had in working together in similar settings. So let's take a step back and talk about the type of setting that in the home that you are developing and what its purpose is and how you will serve our community.
The home that we're developing, it's kind of hard to describe it in just a couple words. We are doing just that, developing a home. So we are going to be, of course, a medical facility, 24/7 nursing care, meeting all the medical needs of these youth in care, but at the same time making sure that it feels like a home environment for them. So we try to treat the whole child, not just see them as a patient with a medical condition. And so our physical location is going to meet those needs. So set up like a home, cozy environment, but still offering the medical care.
And can you describe the type of children and patient population that you're going to be serving?
Yes, so these children come from different areas in their stages in their life. So they could be in a facility that we will most likely get them from a hospital, but they're coming from like a facility or a interrupted foster home or from their primary caregivers. So if certain things happen in the home where they have to be removed and need hospital care, the children will come from the hospital, and then sometimes when you leave the hospital, you're ready to go, but not necessarily ready to go home. those kids will come to us, and then we'll kind of establish the care a little bit better for the home environment for, everyday life. Parents going to work, kids going to school, getting them back to their new norm. And then helping the foster parent or parent navigate the care that they need moving forward.
So let's dive a little deeper and talk more about your patient population. Tell me a little bit more about who you will be serving.
Yeah, I can start it off. So I'm not sure if we kind of talked about the age group that we'll be serving, but anywhere from 0 to 21. The types of children that we would see have, of course, the chronic medical conditions. So anything from diabetes to seizure disorders to brain injuries. We will take kiddos who maybe can't eat normally, talk normally, walk normally, as we would consider it. They typically are coming from interrupted life situations. I think Daphne kind of alluded to whether they're in foster care or leaving their parental home or situations like that. Typically, we're going to be receiving them from the hospital. They're well enough to leave the hospital, but maybe not well enough to transition to a foster placement, or there hasn't been a foster placement identified for them yet. So rather than having the child sit in the hospital room for weeks or months on end, they can come to us and be, in their own bedroom and interact with other children, and continue to lead a somewhat, normal life, getting into a better routine than just sitting in the hospital bed. We have, how many bedrooms do we have now? We have 6 bedrooms. 5 bedrooms.
5 bedrooms. Yeah.
And so, depending on the age and the gender and things like that, they might share a room, maybe 2 to a room, something around those lines. But that can be fun for the kids. It's just kind of like having, a roommate, a playmate. It provides that kind of companionship. The group home is wheelchair accessible, so as I mentioned, some of the kiddos can't walk or have mobility issues, so we are fully equipped and ready to meet those needs. And some of the kids might be more independent, where, if it's a case where a child with diabetes, we might just be helping them manage their insulin or things like that.
And with that, we don't have a time limit on how long the kids are there. There's no 30-day mark, 60-day mark. It's really there for the child's quality, just getting to that basic quality that they need, a higher quality, and training the parents. So as Crystal was saying, they come from the hospital. If they're ready to leave the hospital and they come there, we're might be ready for a foster home, but the home isn't necessarily ready, or the parent needs more training. But sometimes there's a cutoff on like 2 or 3 days of training, 2 weeks of training at the hospital, but they don't feel quite comfortable yet, so we're extending that training there, and we're hoping to take it into the home to be able to still, if they need help, come back, get more training. So our facility allows for that extra time and care in making sure that the person feels comfortable to take that child home. So we can intend on this being a forever home for them. And that is our true goal, to make this a forever home, so that they're not in and out of the foster care system, which we all know that, it's a huge system and there's lots of cracks, but we're trying to fill those cracks and try to make everything better. So just a safe home environment with no limitations on anything, really, when they come there for their care.
And remind me, when you guys were nurses in a previous facility and it had to close, what you've described is very coordinated and effective in really managing and facilitating this experience. Was that kind of the model for it, or do you think that's where they kind of failed? What are some of the sort of challenges that you're hoping to overcome with opening a new home?
I think that we definitely appreciated everything that previous group home was doing for the kids. They had a lot of great systems in place. I think where we want to push beyond that is, like Daphne mentioned, going into the home and providing more familial support, so that those placements are appropriate and so that they do stick. And I think, we want to also be better advocates for care coordination and additional services. Again, that we gained so much knowledge from that previous group home, and we're just expanding on that.
And the care coordination piece, is super complicated even for people that are, well versed in the ecosystem. Talk about the intersection of school and the experience at the home and the ways in which you hope to create that continuity for these patients.
So with that, we have our mental health services, and the social workers that are working in our facility will be coordinating the school. So as soon as a child comes in, they're assigned a child care educator. I think that's what it's called, we're calling. And they will assign them in school. They get put into the school system in our area, and then all those processes start. They get enrolled, they get busing, or even in the interim, we will drive them to school. So the social work piece is very intricate to building out, all the legs to this program, but it's going to help that child become just an overall, like a full surround, like on all the parts of what they need. So that school setting, the mental health services, getting that social work piece coming in and talking to the social worker about school, talking to the nurse and coordinating all the care, and if, any additional services they need, because we will also be coordinating PTOT, speech therapies, and things in the program. So it's really covering lots of bases. We're hoping we cover them all.
And to start, you both will be providing care. Is there going to be other folks on your team to start, and how do you think you'll grow from there?
Yeah, so because we're a 24/7 nursing facility, we'll have our medical director who's going to oversee the program. They'll be hands-on with the kids as well, but the core is really going to be our nursing staff. We're going to have nurses and CNAs, and then our social workers, our behavioral health specialists. We're hoping to bring on nutritionists and kind of like those extra supportive personnel. Daphne can probably speak to the exact number we're at with our nursing staff right now.
To start, since we'll scale up, so we're a 10-bed facility, if we did not say that earlier. So we won't get, 10 kids as soon as we open the doors, but gradually we'll end up at 10 kids, which our ratios are one nurse and 2 CNAs to 6 children. And then once we go up to 7, we'll have 2 nurses and 3 CNAs. So right now to start, we'll have 6 nurses and I think 9 CNAs to start, to help with the 24-hour facility.
And then we have all the administrative staff too, because it's still business that we need like people to make that part of it function.
We'll have 24-hour nurse or staff, and we'll have the regular 40-hour week staff.
That's great.
It's a boastful program.
And what types of, you already said it's going to be 24/7 nursing care, medical care. Talk a little bit more about, the home setting and the things that will go into that. What kind of social supports and other things are you guys envisioning to provide?
Yeah, so again, we're treating the whole person, not just the medical condition. So we will have like behavioral health services within the program itself, so that's something we'll offer in-house. We'll have supportive services like getting the kids geared up for school. We'll be registering them for school when it's appropriate. Doctor's appointments, if they need to make those, we'll be providing all types of care coordination. And then for like the day-to-day life, doing things like sitting together at mealtime and taking the kids out on little outings, doing arts and crafts days, really making it feel like they are with a family versus in another facility.
Yeah, that's great. And what types of partnerships and collaborations have happened to, one, build out and develop this whole concept that you guys are going to have a brick and mortar place, and the things that have come in to support that effort. And as you move forward, the partnerships that help kind of bring the right types of children that are in need to the home, and what are sort of the roles of partnerships and collaborations and as you're evolving.
So we've been working with a real estate company, CBRE, that has aligned us with an investor that has rented the building out to us so that we can provide these services. So we're in the stages of getting the building set for the kids. And we've also been partnering with different communities like Corporate Coalition that's been helping us align with all of the media and social services that we need to get all the things we need for the house, like the beds and the desks, and from lining a business to aligning a house and getting everything we need for there. So all the partnerships and people we've been working with have been so helpful to get us to this stage over the last 3 years. There's been a lot of help coming along the way at the right time, and it's everything's happening when it needs to. It's been great.
That's great. So what kind of growth, as you start to think about your doors opening in just a few short weeks, what do you see in 5 years, 10 years down the road as you continue to serve the children that you support?
Definitely our big picture is we want more facilities. So we will be the only facility like us in Illinois. There's no other location, home, place, anything that meets the needs of this particular population. So there's nursing homes, there's group homes, but nothing that marries the two for these transitional cares. So definitely more facilities. And then we also want to branch into the community more. So offering outpatient services with behavioral health, mental health, therapy, and supportive services for families, as well as for like the kids that are residents with us. Those are our long-term goals. And hopefully eventually, we're just going to expand across the states. We'll see.
Well, you have buy-in from state partners as well, which is wonderful, and I think that's going to be really critical. So, as far as advocacy for the kiddos, do you have any aspirations of policy or other ways in which you see really pushing this agenda that this is an issue that, they've described a patient population of kids, under the age of 21 that really are kind of getting lost in the system. And you're opening a home because, I think what you guys, we didn't get to at the beginning is that, right before the pandemic, you were working together at one and it closed. So what do you think, aside from putting your roots down and saying, we're not going to let this stand as no option, what other opportunities are there to kind of support and elevate this issue?
Gosh, there are so many ways. Working in the schools and working in home health, we see so many things that are kind of hidden only because people don't know about it or don't know what to do because there's nothing out there to reach out to. So to be able to be a child advocate from the school standpoint to the home health standpoint, any realm to go down state and talk to people to bring this more prevalent to the news and so people know that there's somewhere for these kids to go to get the help, even not just for the kids but for the parents to get more training to better the whole system in itself, just across the board, just kids in schools, kids in home health, kids at home just with their parents. I think to be that child advocate downstate and just anywhere to bring this to the forefront is our goal, just to help more kids.
Something to add?
Yeah, just kind of bouncing off of what Daphne's saying, I think there's opportunity to advocate for some funding opportunities from the state for programs specifically like this. There are little things starting to open up, little grants, but nothing that's going to meet the need. So making sure, there's money there because we just need that to get these programs up and going. And then I think a big part of what we're going to be doing is training foster families to meet the medical needs of these children, because that is something that is sorely lacking. It can be intimidating to take on a child with special medical needs, and families need to feel supported in doing so. So being able to help develop programs, work with other, state agencies to make sure that there's more training available to these families, and that they are kind of going out and recruiting more of these caretakers, because I know there's people out there who have big hearts and want to be able to care and provide for these children, but they might not know how to get started. They might, again, feel a little intimidated. So kind of marrying all those things to show them, hey, this is possible and we're here to support you in it.
That's wonderful. I love that. There's a lot of support and advocacy for children in general right now. There's a lot of narrative at the national and at the state around behavioral health being a really critical component to this. But I think that what you guys are sharing in talking about the medical complexity of the physical health as well, that it's going to be both. It can't be just one or the other, and it can't just be that we do know and think and want to be supportive of our kiddos right now. But this is a very critical point in also ensuring the health and well-being of a whole person. And I think that that's what you guys are already starting to do and practice and in theory. And I'm very, very excited to see as it comes together. For our viewers, let's share a little bit about, opening your doors and then what? How can they get you that funding, support, and advocate? Tell us a little bit more about where they can find you on the interwebs and what you would like them to hear.
So we have a Facebook page open, honeysucklehome.org, and then we also have a LinkedIn you can follow, and that'll take you to our website, and anywhere you want to donate is all right there on our website and Facebook. So you can follow us on Instagram. Sometimes we're in there, but Facebook and LinkedIn are our main ones for communication. But we try to keep you informed. We have pictures of the building in its growing stages. We're going back in this week to see all the painting and all the updates. So just follow us for more updates. And it's a beautiful place, and it's going to be a fun and exciting place for the kids.
You heard it here. We're going to build a home for these kiddos that need it. And thank you so much, Crystal and Daphne, for your dedication. I know that this has not been an easy journey, but I think it is just telling of the two people that you are as nurses and as people and as advocates for these kiddos, that they are very fortunate to have you here in our state of Illinois. So hopefully in 5 years we'll be talking about all their expansion. That's all the time we have for today, though. My name is Meghan Phillipp. This has been Community Pulse. You can check us out on CAN TV channel 21. It also is on streaming at cantv.org. Thank you all, and we will see you next time. Stay well, Chicago.